Welcome to Recovery Equity, a series of conversations about how we can reach and help more people find freedom from addiction. This is a space for us to reflect on some hard truths and consider ways to move forward in even new possibilities. I am Dr. Princess Drake, a mental health practitioner with Hazelden Betty Ford. Today, we are talking about adverse childhood experiences, also known as ACEs, brain development and long term effect of trauma on youth in communities of color, with Dr. Rashida Fisher, the program chair for the clinical counseling specialization at the Adler Graduate School. Welcome, Dr. Fisher. Thank you so much for being here with us today.
Thank you. Thank you for having me.
Absolutely. Before we get started, can you share with us where you get your passion for creating awareness and providing education for adverse childhood experiences and the impact of on youth and communities of color?
Yeah, well, I'll say the passion has been very organic and has been a growth out of my own personal experiences. I have experienced some of these ACEs, and so that, along with all of the opportunities to overcome them, has definitely, given me passion, and dedication and commitment to supporting others in that same way.
That is awesome. And we need more people like you in the field. So I thank you. Could you define for us what adverse childhood experiences are?
Yeah, so the term adverse childhood experiences is a growth out of the 1995 research through the Centers for Disease Control and Kaiser Permanente Healthcare Organization. And what they found is that there were a set of adverse experiences that individuals experienced between 0 to 18, that had a really profound e- impact on their growth and development and led to some pretty high risk for poor health outcomes later in life. Those outcomes included health conditions, risk for acquiring chronic health conditions, mental health disorders, including addiction and substance use disorders, poor academic performance, leading to poor work outcomes or employment status, and then unfortunately, early mortality.
So it really does include a lot of things in terms of just various aspects of someone's life. And how would you define the category of youth?
So for youth, we are talking about 0 to 18. And I actually would like to expand it to what we call emerging adults, which is at 18 to 24, 25. What we know more and more about brain development is our brain is not fully developed until at least our mid 20s. And some research even suggests all the way up until our 30s. But that understanding of brain development is also important for understanding the impact of ACEs, and why when we think of youth, we should include those emerging adults that are starting to, go out in the world and be asked to make some really significant decisions, and manage a lot of things in life.
Absolutely, absolutely. And when you start to think about whether someone is a clinician or just a person living in a community and has exposure to individuals, how might you know someone has been exposed to ACEs and what should someone look for?
So let's take a little step back. The ACEs there's a lot of different things that can be considered an ACE. The original research identified things like abuse and neglect, so various forms of abuse, physical abuse, sexual, emotional abuse, neglect, like not having your day-to-day needs met, and then household dysfunction as things. So we can, know individuals in our communities who has a parent that is living with a mental health condition, or is out of the home, or there's been domestic violence in the home. And if we know those things about a young person, then we can automatically know that they have experienced one of those ACEs. But if you don't know anything about the person, one, we can ask those questions. We can ask about their experiences in life that have caused them to feel unsafe and not have stability in their growth and development those critical years. But also we might look for things like poor concentration and difficulties in school, difficulties with relationships, sometimes lots of agitation and irritability, being really excited very quickly. Some young people will talk about and report various physical symptoms in their bodies, so headaches and stomach aches and things like that. Sometimes even just like pain, muscle tension, and those kinds of things. So when we're seeing those signs of distress in young people, we might begin to be curious about their household functioning, their experiences growing up, and what that means for what's happening for them and the presentation, the behaviors that we're seeing manifested.
And just to take a little more time with that specific question, Rashida, would there be ways in which you would want to ask those questions that are developmentally appropriate? Because oftentimes I think we try to talk to children like we talk to adults, and that may not always convey what we need to either get in terms of information or otherwise.
Yeah, absolutely. It is very important to be developmentally appropriate and to reword questions. For a teenager, you might be able to ask directly, has a parent been incarcerated? Have you witnessed domestic violence in the home? Does a parent have or live with a mental health condition? Have they experienced physical, emotional, sexual abuse? But even for teenagers, they may not um, answer those questions directly. There may not be enough trust established yet for them to disclose that information. So really asking questions about their sense of safety and the amount of stability that they had growing up is a way to ask that question that is developmentally appropriate across the developmental stages of childhood through adolescence, and that emerging adult population.
Thank you for those tips in terms of being able to communicate better with when it comes to youth. What would you say are some of the consequences of ACEs on mental health and wellness?
There are a lot. And people will respond to these experiences very differently. But what we know from the research is, especially for young people, for youth, we will see difficulties with academic performance, just not being able to have good concentration. There may be other behavioral kinds of issues in the classroom, difficulty with establishing and maintaining peer relationships, and then symptoms of depression, symptoms of anxiety, symptoms of trauma. Because when we say ACEs, what we're really talking about are conditions that promote toxic stress. And we use toxic stress and trauma really interchangeably in the field. These are experiences that overwhelm a person's ability to cope, that it's more than what their body and their external resources, so internal and external resources, can manage to maintain balance and proper functioning.
And to that effect, Rashida, has there been specific mental health diagnoses that you see more commonly with patients or clients who have ACEs?
Yeah, I would say again, it's gonna range, but you can see some of the again, it could look like ADHD because of the hypervigilance that comes along with being primed for scanning the environment for threat. And so it can, and then the hyperactivity, the trying to protect oneself. So that can be a common diagnosis, or it could look like ADHD. It can look like depression, can look like anxiety. In young people, it can look like reactive attachment disorder. It can look like oppositional defiant disorder, um, as a person, again, is trying to manage that sense of threat, and feel empowered, at the same time. So exposure to ACEs, again, can look like various mental health conditions. So it's really important for us to understand that ACEs could be potentially present, and consider that as we are, looking for and matching diagnostic criteria.
What would you say are some unique considerations of ACEs for youth in communities of color?
Yeah, absolutely. So the foundational research for ACEs was really groundbreaking and had a profound impact on how we understand trauma, how we understand toxic stress, and how it impacts the development, not only for young people, but how that then has long-term, lifelong consequences into adulthood. And so now that we've used and have a really good understanding of this information, we are moving towards expanding the parameters, including other kinds of experiences that are also challenging, that are also toxic, or create that toxic stress. And so for communities of color, for young people of color, those childhood adversities should include considerations for experiences of racism and discrimination, the idea of minority stress. We have kind of uh, ancillary research that shows that experiences of racism and discrimination, experiencing minority stress, experiencing historical trauma, or collective trauma of a community, can have and cause people to kind of develop and manifest symptoms of mental health disorders like depression, anxiety, PTSD, and things like that. So, including those in our understanding of ACEs for young people of color, and indigenous youth is also important.
Would you say specifically in your specialization that you often see these things become more increased with social issues that are around the world or different things that may be happening?
Absolutely. So, being exposed to community violence. And so if we look at some of the things that have been happening, and young people are exposed to in the media, seeing it in their neighborhood, all of the various protests and riots that have occurred, our coverage of police violence against Black and Brown bodies, all of those things, it's community violence, and community violence should definitely be considered when it comes to the ACEs and how that will have an impact on a young person's development. Also things like poverty and intergenerational poverty, removal from the home and being placed, outside of the home into foster care settings, and things like that as well.
Thank you for the additional information, which is really helpful. And so now that we know the certain groups that are more likely to experience ACEs, what can we do?
There's a lot that we can do, and some of it is on an individual basis. So once you know and understand that a young person has experienced these adverse experiences, getting them help, um, and just being compassionate with them. I think in the various systems that young people find themselves, whether it's in the school system, if there are placements out of the home, understanding that they have developed very sometimes maladaptive ways of managing those experiences for themselves. And so we want to be compassionate with them and understand and believe that they have the capacity to relearn healthier ways of managing that stress. We can do that by developing and nurturing resilience within them. Many people believe that resilience is just kind of this internal characteristic that either you have or you don't have. But really, resilience is something that is developed and nurtured in individuals. And it's a combination of supporting and developing internal resources. So learning how to manage the physical and emotional sensations and consequences from ACEs, but then also external resources, having reliable, consistent adults in one's life, having opportunities where a person can feel accomplished, and having high expectations for a young person, but that are supported in their achievement of positive goals.
And to that note, as a final question, Rashida, if someone were listening in or watching this today that they know either themselves have been struggling or maybe they know of a child who's struggling with ACEs, what would your message be to them?
My message would be to understand how profound those experiences are. I think sometimes we overestimate how important it is to have safety and stability in a young person's life. We overly assume or misassume that young people can bounce back. It's not having a profound impact on them, and when it really is. And then I would say find support for them, and try to be that consistent, reliable adult figure, especially if they don't have that in their home.
Thank you so much for that message of hope for individuals. On behalf of everyone watching or listening in, I want to thank you, Rashida, for giving us so much information to think about and take into our own lives. And to everyone out there, please let your friends and colleagues know about these conversations and come back often to catch more episodes of Recovery Equity. Together, we can build a healthier, happier, and more equitable tomorrow.